Today we're going to be talking about a certain type of cancer. And you may know about a lot of types of cancer, but this one affects like 160,000 people per year. And it's actually lung cancer. And it's more than breast cancer, colon cancer, pancreatic cancer, prostate cancer. So it's a real big hitter. So basically, we've got a good show here for you. And our first guest is going to be Dr. Nassim. Welcome, Dr. Nassim.
All
Good
right. To see you,
I'm
old
so glad you
friend.
could come here. This is
Yeah.
great.
Good,
So,
good. Thanks a lot for having us. It's
all right.
very great to be here, and I'm so thankful for having such a good friend.
Oh, great. So can you tell me a little bit about the cancer we're talking about
Sure.
today?
We are going to talk about lung cancer, and we are hoping that we can encourage more people to go for their annual checkup, and also we're going to talk about the pathophysiology, why they get it, from where they get it, and what sign and symptom they have to look for it, and also the help which is out there for them, and community resources also.
Sounds really good. I'm sorry, but
no, that's fine.
So
let's
go
start
ahead.
with the lung cancer.
Give us a little background.
We have two kind of tumor in the lung basically.
Mm-hmm.
Some of them are benign, which they're not gonna move, they're not gonna bother the other part of the body. They stay where they are, and we're not gonna usually do something about it.
I see.
Mostly, but another time, which is another one, which concern most of the people and most of the doctors, are the cancerous one, which they can be originated from the lung, or also other kind of cancer that started to spread out and go to the lung.
So it starts in another location and then spreads to that area.
Yeah, exactly. That's a big hit, and mostly people get scared of it.
Right.
But the huge thing that we need to know about it is the early disease, early treatment, and finding out about that, and then we can be able to treat it better.
Right.
I guess I was calling two of my good friends, and they have different. One of them is benign, other one is cancerous, and we have been asking them to come over. I don't know. Did you get a chance to contact them?
Yes, right. So they're going to be part of the show. They're right here in the audience.
Okay. Then before asking them to join us, I just want to say one more thing about the lung cancer is when it's developed and the normal cell started to grow more and more, then they are not able to basically do their normal job, which is exchanging the O2, which is oxygen in the air, and CO2, which is the waste product of the cell metabolism. They are not able to do that, and also they started to move everywhere. They invaded the nearest spinal tissue or the farthest end, and it's why we get the sign and symptoms, because, for example, they obstruct the airway, and then you have hard time breathing, or you become short of the breath. And also they can go to the lymph node and cause that kind of problem, which we're going to cover on, and we're going to ask our friends to talk about it.
And that's going to create a whole other
scenario,
system type problem.
Yeah,
so
exactly.
Be really bad.
Yeah, exactly. Then if you would like, we can call them up and see what's going on with them, and then maybe we can talk more about it.
Okay, great. Okay. So, Inda and what was your other friend's name?
India.
Oh, yes, all right. That's the one that's confusing. Inda and India. Come on up here. All right.
Hi, how are you?
Oh, hi. So glad to meet you guys. Glad you could come. And
Hi.
You're Inda and you're Inder?
Yes.
All right, so I got it great. Thank you.
Nice to meet you, Dr. Stephan.
Hey, thank you
Hi,
for
Right.
coming. How are you?
All right, can you guys sit down then? And I'm going to just sit here. And I'm so glad you guys could come here because I know it's kind of hard to talk about cancer in a way. And I really appreciate you guys coming in here and being able to talk about it. So this is going to be a really good show about education. So Inda, can you tell me a little bit about your type of cancer?
Yes, so a few months ago, I was playing with my son, and I kept having episodes where I would be short of breath, I would start wheezing, and it was scary. I don't have asthma, don't have COPD, I'm not a smoker, so I couldn't understand why I couldn't breathe.
Wow.
So it was quite scary. I went to the doctors to get a checkup, routine, and what they found after doing a CT scan on me was that I had a benign lung tumor. I have a X-ray here.
Oh, she had
Oh, wow.
an X-ray.
That's really good.
Yeah, so it's quite large, so that's why I started to have symptoms. Usually when it's smaller, what I was told is they may be asymptomatic, but
I even noticed that now you are doing the normal talking, you are catching your breath here and there. Yeah.
So it's a scary experience, but In my particular case, my tumor is just going to be watched by my doctor. If the symptoms become worse, I could have it surgically removed. But my tumor, I was told, has molecules that actually make it sticky, so it stays in a localized place, so it should be staying in that area, as opposed to lung cancer, which can break off and spread. So that's on the good note. I don't have lung cancer, just a buildup, a nodule buildup of fat, cartilage, and tissue.
And they usually have calcium on them too, correct? Did your doctor told you about that?
That's what I was told,
Yeah.
yes.
So, well, you sound like you got a really lot of good information from your
I
doctor on
did. I was thankful to have a very knowledgeable doctor.
that. Okay. Let's talk about the cancer Inder has. Can you talk about it?
Yes, about a year ago, I was diagnosed with stage 4 squamous cell carcinoma of my lungs, and at first I didn't know anything about it. I was having trouble breathing all the time, as Inda said, but I also was coughing up blood.
Oh.
So I couldn't figure out. I knew there was something wrong with me. So when I went to see the doctor, they diagnosed me with squamous cell carcinoma stage 4, and using MRI and biopsy of the tumor. So right now I'm on chemo and radiation therapy and fighting this thing.
Oh, so how's that going for you?
It's
Is it
actually
tolerable?
going good. This is an X-ray of my type of cancer. As you can see, it's spread all over my lungs.
I see.
So,
I have Dr.
Alrighty.
Nassim come back and just talk a little bit more about the cancer, the two different types.
Yeah, as they both of our friends here talked about it, there is not really significant sign and symptom that you can put your finger on it and separate these two. But basically, we go to the diagnostic test, X-ray, biopsy, and all of that to be able to recognize if they are benign or if they are not. Also, there are a lot of community resources. I don't know if you guys did your part on it and have been using them, but there are a lot of groups that gather together. They talk about it. They prepare patient for those and support their family as well. I was wondering if in the audience we have any people who are in risk for it, because secondhand smokers,
Right,
people,
right.
the people who are working in the places like farm which has a lot of dust, or people in the factory which are working with a lot of chemical,
Yeah, that's true. We're
have
going.
a risk factor for it. But I don't know if in the audience we have somebody.
We'll
who-
probably ask. Just one other thing we wanted to say is that like early detection is really important in cancer. Like if you detect the cancer earlier, you have a 53% chance of curing it. But if you wait till sometimes not in your particular case, but sometimes if you wait too long, the survival rate's like 3%. So it's something that really says that you should really try to find it as early as you can. So let's see if we can find someone from the audience that maybe is a smoker that can come up here and talk with us. So is anybody out there that is a smoker right now or wants to come up here? Oh, hi, come on up. And what's your name?
My name is Joyce.
Joyce, hi, come on.
Oh.
Come on down. So tell me, you're a smoker or?
I've been smoking for about 3 years now. I'm 21 years old, and so since I was about 18 years old, and a lot of people in my family smoke, so it's really hard to get away from that. I've been wanting to quit, but my job's so stressful. Being a nurse, it's just, I know I should quit, and I'm a patient advocate, but it's just so hard. But I've been wanting to.
And so, how do you think you're going to stop smoking? I mean, what do you think would help you?
I don't know. I guess I saw my grandfather. He died from lung cancer, also because he smoked for a really long time. So I guess I could just take that into perspective and listen to these stories, and I just think community resources also, because I don't really know any.
Well, you know what? Since this is a show about helping people, what we're going to do is we're going to pay for some of your doctor's consulting fees so that
That'd be wonderful.
So you can get some help with it, because it takes a lot of
it does.
work.
It's really hard. I've tried in the past. I'd quit for a couple of days, but I'd get those.
Okay. Well, great. So I'm just so glad you guys all came here, and So wrapping up the show, Dr. Nassim had a few additional comments she wanted to talk about manifestations.
As I said in the beginning of this show, the lung tumors in the cancerous kind gonna spread everywhere. And if, for example, they're gonna make obstruction on the airway and then give dizziness. But in the benign kind, it's still huge thing, which is not normally there.
Right.
And it's gonna put a lot of pressure on the nearby other organs or things in your body. Also, compression of the esophagus can lead to the dysphagia. These people usually have a hard time swallowing. And
so there may be a reason to have a surgery later point in time.
Yeah,
exactly.
To kind of get rid of these kind of silent symptoms. Also, they have been talking about the chest pain, arm pain, and shoulder pain, and all of that is because of these tumors, either benign one or cancerous one, can put a lot of pressure on the nerve, especially on prevascular nerve, which will lead to the chest pain, shoulder pains, or arm pain. And thanks a lot for giving me this time, and hope to see you somewhere.
So we're running out of time.
Yes.
That's the wrap on the show.